All right, we have just about 1 minute, but feel free to say hello in the chat. Introduce yourself if you'd like. Well, let's get started. Good afternoon, everyone, and thank you for attending today's Lunch and Learn. This is the IPHA Lunch and Learn on the third Thursday of the month. And so thank you for being here. This will be recorded and this will be posted to the IPHA YouTube channel afterwards. Please mute your microphone if you haven't already. Like I said, feel free to introduce yourself in the chat, say hi. You can also put any questions in the chat at any time, but just know that we will do a Q&A session at the end. So there will be plenty of time for live discussion. And at that point, feel free to take yourself off mute and turn on your camera. And you can also ask questions that way as well. So today I am thrilled to introduce you to our speaker, Courageous Fire. Courageous Fire is a certified community health worker, consultant, trainer, women's empowerment speaker, and an award-winning professional. She has 12 plus years of curriculum development and experience and 5 plus years of independent studies in historical and systemic racial impact on Black women in domestic violence. However, the most important part of her is that she is a lived experience expert in the layered trauma language of Black women who have survived domestic violence and brings that continuing education to every part of her work. Using the simple definition of healthcare, the organized provision of medical care to individuals or a community, Courageous invites organizations to see themselves broadly as an active part of healthcare and helps them understand how that can look as they learn how to use their growing understanding of trauma language to be in the solution to better health outcomes for Black women. She's been looking forward to this conversation for a long time and is eager to share some of that with you today. So please help me in welcoming her. And like I said, we will open up at the end for more Q&A afterwards as well. Thanks for being here, Courageous.
Thank you, Jenna. I'm so grateful to be able to be in this space today. So as Jenna mentioned, please put your questions in the chat. I'm going to try to stop right about 12:30 just to make sure that we have time for being able to get all of your questions in. No question is a bad question. No question is too intrusive. When I started this work, I decided that I wanted to be your Rubik's Cube of sorts that you could turn over and understand better so that it's easier for you to increase safe spaces for Black women in your work. And with that, let's talk about my mission statement. It really is just simply that, to increase safe spaces for Black women. And so here's the thing. The problematic facts are that research shows that Black women and other women of color experience the worst health outcomes of any group in the United States, regardless of our income level. 66% of Black women report not feeling emotionally safe at work, with some saying that people doubt our authority, authenticity, knowledge, and experience simply based on our skin color. And the Black Women's Health Project determined that domestic violence is the #1 health issue facing Black women because 40% of us will experience it during our lifetime. So the translation of those facts is that 3 glaring situations where we need to increase safe spaces are in healthcare, employment, and in victim services. Organizations that want to work with or serve Black women actually need to know our unique and layered trauma language. So the solution I have and that I bring is to teach that. I want to kind of talk about what that looks like in those 3 areas specifically. Courageous Fire LLC truly brings an interpreter approach to solving those problems that I identified. So the way that it looks in healthcare, and this is high level overview of what training and consultation with me looks like, is equipping healthcare to understand the origin of trauma language and its misinterpretation in healthcare. Helping them learn how to reject the media induced biases, and the training gets very specific to that, identifying links between unresolved trauma and chronic health issues, including serious and life threatening health issues, and then helping healthcare be introduced to other organizations that are incredible interpreters that they can be able to experience their expertise and continue their growth in how they approach this specific group in healthcare. In employment, it looks the same as far as the trauma language, misinterpretation, and rejecting the biases, but we also include in this experience together identifying and removing barriers, including what it looks like to de escalate conflict so that the space returns to being a safe one for Black women, and then using an organization's or a corporation's current resources to disrupt future and current barriers that their employees are facing. And then the way this looks in victim services is again, understanding that origin of trauma language and misinterpretation, but then in their work, helping them identify links of between that origin and crisis behavior. What does that look like when you don't understand it and you think, well, I'm hearing what is said and I don't think it links up with what I see, so maybe I should reject what I'm hearing them say. So helping them understand how to believe what is being said versus what is being shown. And again, learning how to de-escalate when conflicts arise so that victim services can stay safe for Black women who are needing to utilize that resource. As you might have guessed, I'm also a survivor of domestic violence myself. Because of the normalization of violence against Black women and in Black communities, I didn't even realize I was growing up in a emotionally abusive and verbally abusive home. When I became a young adult, I came to learn that I was also in a household where sexual violence was being committed against a sibling of mine, and I didn't even realize, again, because I didn't know what emotional and verbal abuse looked like, that I was watching my mother on a daily basis be a victim of that as well. So, of course, with that normalization of this is just what homes look like, I ended up choosing a man that was very similar to my father and his behaviors, which led to me experiencing almost 15 years of an abusive marriage by the time the divorce was final. In studying myself, along with independent studies on Black women in the United States, I came to understand the reality that I shared with these women, which is that many of us don't know when we're being victimized because of the normalization of violence against us in the United States. And when we do realize it, we have very few suitable places to go for help during and
I hope
after.
kids. I thought we'd have extra money if I told them what they could use it for.
So one of the things that I realized in my work is that, first of all, I should focus on Black women because who better to talk about what's happening to a group of people than someone from that group? So changing the narrative for Black women included me being willing to be the educator about us. Um, I realized that I wanted to separate this work in developing an approach that I thought was not only innovative, but that I was hoping would be effective more than what's been happening before I started this work 5 years ago, was to look at, is there a way to categorize who is needing the education so that we can have a better experience? And I settled on two very distinct categories: centers of must and centers of trust. So, centers of must are exactly what they sound like. They're places that Black women go to because we have to. So think of places like um, having to go to a doctor's appointment or take one of your children to one, having to go to something for one of your children at school, having to go to work. If you need some sort of state or city or county level assistance, having to go into those spaces. They're usually spaces that are led or run or owned by mainstream America, so white Americans. Um, and they're places that she doesn't expect to be safe, but she goes when that's her only alternative. Centers of trust look different, and they're usually places that are part of the Black community. They're usually Black owned or Black led spaces. And when she goes, she assumes a few things, that she's going to be heard, that she's going to be in a safe space, that that space can be safely confidential for her, and that if she reveals some sort of problem that she needs assistance with, she expects to receive resources that these areas have already deemed to be trustworthy spaces. The problem with both of those spaces, unfortunately, is that both of them are part of the problem of Black women not having very many places that are educated on what her needs look like. I can tell that in the 50 plus trainings I've done in both categories, that it is possible to educate in a way that facilitates that leaders feel safe, informed, and equipped, and that organizations then have options to shift to a more effective approach in the way that they work with Black women. Again, I said research has taught me that it's a health issue for Black women, and in some studies it's number one. It definitely has long-lasting individual impact, including chronic physical illnesses, including serious and life-threatening ones. That the lack of support impacts us in many unique ways, including coming from our own community. And there is a generational impact that looks very much like what I described to you of my own. We grow up in it, we normalize it, we then perpetrate or accept or become parts of those unhealthy cycles as adults. Our children watch the same thing and it continues to repeat itself. Not understanding this as an individual resulted in 48 years of me not being able to grasp why I persisted in such disadvantaged circumstances in my adulthood. And I wanted to change that for other women who looked like me and who had been living like me. So I kind of want to talk a little bit more now about, well, what has happened in the 5 years of me doing this work with this focus. Here's a few of the things that can happen and that have happened with partnerships and consulting with me. We've been able to build the following supports. So there's an Iowa statewide resource right now called Back the Black. In a partnership with Iowa Healthiest State Initiative, we were able to build a resource that provides Black Iowans with culturally relevant mental health support tools. It was actually launched in May of 2023, and we continue to work on educating the community at large, because the parts of the centers of trust need to know about it so that we can be safe spaces for people in the Black community. But then the centers of must need to know about it so that they can be able to provide resources and information about how to use this culturally relevant resource. It even has a link to the list of Black therapists in Iowa as vetted by the American Psychology Association. We've also been able to, in a partnership with Iowa Coalition Against Domestic Violence, in consulting with them and building this for them, they now have an entire module within their mandatory advocate certification training on effectively meeting the needs of Black women in their work. So the coalition is actually the statewide resource that provides training and certification to folks who are going to be certified advocates for domestic violence and sexual assault in different organizations. They have mandatory training to get certified, and that is now built in to being part of that training. In New York, we are working with the Office of Victim Services, informing them, and this project has been going on since 2022. It's scheduled to wrap up somewhere in the fall of this year. We are providing them recommendations on how to include under or unrepresented groups that they've been missing today in victim services, and how they can remedy this in their future work on funding. So they're missing funding the organizations that are really hitting this target group and other underrepresented groups. And I've been a part of that project and being able to inform what they can do to fix that. I started a nonprofit called Courageous Access, And I developed a curriculum that through that nonprofit has been provided to Black women since 2020. And we do year over year surveys to check in with them to see, are they able to still stay out of those cycles of violence, not just in intimate partner relationships, but in friendships, in work relationships, in their church circles, with family, with friends. And we still are maintaining a nearly 90% success rate in Black women through this curriculum being able to avoid future predatory cycles. And then we even are so excited about how the work is starting to blossom out in things like communal events, such as the upcoming private sister showing that will be happening on June 29th, that will provide a safe healing space for 186 Black women while educating them on the important health concerns of domestic violence, HIV, and its treatment, and mental health treatment. What can happen when you partner with my work? So you can help me with getting my work into the corporate space on a much broader level by helping me teach human resources leadership how to spot domestic violence in their team members, because statistics show that a third of the women in any workplace and a fourth of the men in any workplace in the United States are currently dealing with domestic violence. This is not just Black women or people of color. We're talking about, period, a third of the women of a task force, a fourth of the men. So in partnering with me and getting me connected to human resources leaders, you can help me teach them to spot that in their team members, utilize their current resources to disrupt, and even be able to help those folks get safety planning training from experts right there in the space that they already occupy. You can also help me with teaching healthcare leadership how to screen for domestic violence with Black women patients. There's a lot of screening out there, but there is a very specific type that works very well with the unique needs and the trauma language that we speak in screening, so that they can use their current resources to connect their patients to effective resources and remedy their policies and practices that are creating barriers to good health care, including things like understanding how you speak about your patient who is a Black woman in notes can make a difference between them getting good health care from the next provider or not. You can also help me teach child protective services leadership, how to support Black women who are healthy parents in relationships where domestic violence has been discovered, center the accountability for the parent who is doing the harm, and sustain stable homes for co-surviving children versus thrusting them into the foster care system, which has shown that it has created even more harmful spaces. And finally, you can help me teach justice system leaders like judges and law enforcement officials the updated resource on how to keep domestic violence victims, survivors, and co-survivors who are their children safe from homicide by centering the more reliable signs of intention for homicide versus the current concentration in our country today, which continues to look at the most recent incidents of violence. So what can you do? What does that look like? Number one, you can get familiar with cultural resources. And for instance, the link on the website through Back the Black of the Black Therapist in Iowa. For instance, survivor support for Black women through our sister nonprofit called Empowerment Through the Arts. Our co-survivor support for their children called Youth Healthy Relationships. Those signups are always on our website. If you look at Courageous Access on Google and you get to that website, right there on the home screen, you'll see a sign up link for both of them. These are free resources. And then the mental health supports by category throughout Iowa. Again, on that Back the Black, the address is iowahealthyestate.com/Back the Black. And then you can also get familiar with effective mainstream resources. For crisis response, I am not the best person for that. I do events like these. I do training all throughout the country and sometimes in other countries. And so I'm not always available when someone is in domestic violence and they're looking for a way out. You can help them by connecting them to Iowa Coalition Against Domestic Violence. Or you can help them by getting them to a 24/7 national resource, the National Domestic Violence Hotline. They can chat with them and get a safety plan and get help and resources nearby by zip code through those experts at thehotline.org. They don't have to worry about the police being called because they're not a mandatory reporter, or they can call that 800 number, 800-799-7233. You can also become a partner. You can have a virtual conversation with me on how to do that by going to my scheduling link right there at calendly.com/courageousfire. You can call or text me at that number. You can email me, or of course, you can direct message me through LinkedIn, Facebook, or Instagram. And of course, if all of that went by you and you're just like, I'm just eating my lunch and I don't have time to write stuff down or do screenshots, don't worry about it. You can find the same information at my website, cfirellc.com/home. Again, you can go to my website, which is cfirellc.com/home. I'm so grateful to you being here, and I got done a little early. I hope I wasn't fast talking. I try not to do that. But yeah, we've got a lot more time now for any of the questions that have come in to the chat while we've been doing this. And I'm going to pause the screen share, stop sharing so that you can see my face when I'm actually answering questions. And feel free to, Jenna, if you don't mind helping me with questions that are already in the chat. Once we've gotten all of those, then anybody else who has questions, if you're comfortable unmuting after that, feel free to do that, and we'll make sure we get your questions answered.
Courageous, I do not have any that are in the chat yet. Are you able to go back to your first slide?
Yeah, I sure am. Hang on.
I did post the links in the chat, so click on the chat if you haven't, and you can, bookmark some of those links. Okay, maybe it wasn't the first slide. It was the one with healthcare and,
Here?
yep, here.
Okay.
So my question was in regards to trauma language.
Yes.
And like unintentionally speaking language that is harmful to trauma survivors. Like, is there,
Yes.
and I know that this topic is deep, but is there like just one or two things that you could say to that happen often in either the healthcare setting or the public health setting, or just in general?
So if we're talking about the layered trauma language that Black women speak, or are we just talking about trauma in general?
I think either.
Okay.
I would be interested in trauma in general, but I
Okay.
certainly would be also interested in more specific, how it might be different for Black women.
Okay. I think sometimes we don't think about how certain word choice can feel like this is no longer a safe space to go any further with a need that should be expressed, such as you feel like, or you said that, or you felt like, it looked like. That type of language always sounds incredibly suggestive. And when you're talking about a person who's dealing with trauma, and this isn't necessarily, mind you, a healthcare professional saying this regarding trauma, because they might not know that the person's experienced any. I'm literally talking about a person describing their symptoms to a healthcare provider, and the provider saying, I think I heard you say, and as they're trying to recap or restate for clarity, they choose those types of words. What that says to the person is, you don't really look at my version of my account as necessarily being factual. You don't look at me as a credible resource or source of information. So immediately the person thinks, if you don't think that me describing my headache is accurate, I certainly can't ask you for help on. And then there's this whole other thing that they want to open up, but they don't, because of that type of language. When we're talking about that, as we move specifically to Black women in healthcare, again, not necessarily, you may not know that this woman is dealing with trauma, nor may she, just so we're clear on that part, But again, she's describing what's going on with her, and immediately there becomes this shift of body language from the provider. So maybe you were leaning forward when she first started. She starts to describe and you sit back. Maybe you were like typing or writing notes when she first started, or assuming a position as though you were going to type or write notes, and then you stop. Again, that's a signal that, oh, okay, you don't think I'm here because my problem is that bad. Or even in the early stages of assessment, maybe we're talking about ER visits. So she starts to describe her thing, her situation, and they say, okay, well, on a scale of 1 to 10, how would you rate your pain? This happens commonly with Black women. We say it's a 10, and we say it like that. It's a 10. I would absolutely give it a 10, but we're not crying. We're not exhibiting certain signs that they think we should be exhibiting. We're not holding that place. You don't see that the eyes are tearful in any way. Our voice isn't breaking. None of that's happening. We're just calmly describing what it is. Immediately, there becomes this posture of, oh, well, it can't be that serious because she said 10, but she's not saying it the way we're used to people who have 10s expressing that it's a 10 or an 8 or a 9. So immediately the conversation shifts from the level of pain and getting something for pain management to, well, is this the first time you've heard about it? Well, are you on any medication right now? Well, have you ever talked to your doctor about it? Well, what have you tried before? Instead of, if someone else had described a 10 and they had been tearful or holding that place, it would have been, okay, let's see what we can get you for pain management. Can you describe the type of pain? We immediately shifted from that, and now we're asking unrelated questions to pain management. And we know that when we hear it, and that lets us know this is not a safe space. If I can't afford the medication that they say, if I tell them that culturally I'm not comfortable with what they've provided to me, it tells us that immediately based on where you go from there.
Thank you. That was very helpful.
Good deal. I know that I see a bunch of stuff in the chat. Maybe that was just introductions. Is there anything that someone wanted to ask that you just want to unmute and ask me? I'm so not accustomed to not getting questions.
This is Janine McDonald. Courageous, when I taught at DMU, had a student that worked with you a year or so ago, and so appreciate that learning opportunity.
Oh,
Thank you for that.
sure.
I am hearing you talk about healthcare providers, and you mentioned child protective services. Can you talk about, do you have experience or insight to share with us about us specifically in public health and the kinds of harm that we might be inflicting with the kinds of languages or the services or the programs? Any advice for us specific to our work?
Oh, that's super duper loaded. So when you talk about the language of the programming, so in the Black community, just whether that's male or female, whether it's adult or child, there is a huge stigma around victimization, around help, around assistance, around any of that. In other words, what I mean by that, Janine, is it's not a popular concept to act as though you need help. So a lot of times programming will be talked about as though it is helpful. And I understand that. I mean, that seems like for everybody, well, why wouldn't I say, we're going to help you with this if you've been victimized by this, if you have this problem, if you're in this situation, here's what we can do. The reason why it's not helpful is because we are automatically going to turn away from something that is described in those terms. Especially when you talk about Black women. My training gets into a lot of the historical content, but just to give you a little bit of that, Janine, essentially, we have been trained by our history in this country and in our communities as little girls growing up into women that a Black woman is supposed to be strong. A Black woman is supposed to be independently so, and she's supposed to be able to handle things on her own. And so when there's things that talk about victimization, when there's things that talk about help, needing assistance, things like that, it automatically is something that we instinctively say to ourselves, if I'm as strong of a Black woman as I should be, I shouldn't need that sort of assistance. I should be able to pray that away. I should be able to tough my way through that. I shouldn't need to do that. And then public health spaces, again, are typically white led, white run, white owned spaces. And so if it's not being given to us in a space that we trust, which is why I got so excited when I learned about community health workers, because they're really great for making sure that someone that Black women would trust is the person that's approaching them. So for instance, we have an organization called Black Women for Healthy Living. So whereas I might not, or another woman like me may not even hear about, or if we do hear about, wouldn't even go to things that have stamps on them of being a public health association type of thing, or this is a public health issue, or this is a public health initiative, or whatever, we may not see it. And if we do, we're probably not going to touch it. But if Black Women for Healthy Living was sponsoring it, or Courageous Access was sponsoring it, or we were hosting it, or something like that, that's going to be something that we're going to pay attention to. If it's in an environment from someone or an organization that we trust, and it's in a space or it's set up in an environment that we feel represents something that is a safe environment for us. Maybe it's in the setting of a block party. Maybe it's in the setting of something that everybody's coming together and we're all bringing cultural food and we're attending. Those types of spaces with a public health message after we get there from someone we trust is something we're going to look at, with a message that doesn't talk about us as though we're victims, but talks about it as though, hey, this is yet another support, or this is yet another resource, or this is another tool, or this is another way that you can empower or equip. Those types of words resonate much better when we're talking about Black women or even the Black community at large in public health. Does that help?
Super helpful. Yeah, thank you. So trust, being invited, not showing up to help, being invited, and trusted messengers and points of entree. Yeah, I hear you. Thank you.
Yeah, absolutely. What other things have you wondered about as far as public health, messaging? And then, I mean, let's really think about it, right? If we're talking about Black women, especially, health outcomes are usually, for our group, the worst in this country out of any group. Why, with all of the money that is constantly poured into public health initiatives, programs, projects, events, why isn't it getting better, right? What are your questions about how that can look different? Innovative strategies, anything. I'm not hearing anything yet, so I will say, I wanted to be clear that even though I talked about healthcare, employment, and victim services, and a lot of times public health feels like, well, you're talking about providers, and it's like, no, not necessarily. I'm talking about, as Jenna mentioned, the broad healthcare definition of folks who are trying to make better health outcomes in whatever it is you're doing, however it is you're approaching it. If you don't understand the origin of the trauma language of the groups that you're trying to help that are having the worst outcomes, and then how that language is misinterpreted, your initiatives, your events, your efforts are often going to be ineffective, even though they have a big spend. So what are the ways that public health can get better educated on that? And again, you need your interpreters in those different communities where you're trying to get those better health outcomes. That's what's missing.
Courageous, there is one comment in the chat. The term victim services also feels harmful to me.
Yes, that is a term that I use simply because that's what people know what it is, right? But
Mhm.
you're right. Um, Survivors, co-survivors, in our nonprofit, that's the language we use. If people in that industry talk about, what does Courageous Access do? I always say victim services, right? But no, when I'm talking to Black women, absolutely, we don't use that language. You can't. It is very off-putting. So you're absolutely right.
So I read something a while ago, and I haven't been able to find the source of this, but it was a little bit disturbing to me to think about the implicit bias, not the implicit bias, but the roots of trauma. But it was about parenting and how women, Black women, talk to children and how they treat them, and the perception that people are treating children sometimes a little bit like rougher, talking about them rougher than you might see other populations talking about children. And the explanation was that over centuries ago, Black women had to talk about children in a rougher way, like in um in a person like a way of not sharing their strengths. And that was done, the explanation was so that like to discourage children from being sold when they were enslaved. And I was like, oh my gosh, that's horrifying, to think that that was how people adapted under those terrible circumstances. But do you have thoughts on that? Is that, what do you think?
Thank you for that call out. And yes, so Black mothers in the United States are an incredibly adaptive group of people because yes, we've had to be. And I say we because I have two daughters. So yes, we've had to be. And that was some of the adaptive language back then. Today, the adaptive language looks more like mothers trying to prepare our children for what they'll experience as children and what they will experience as adults. So um, the language may look a lot more like I need to make sure that you understand um, how unforgiving and adultified you will be as soon as you enter society. And I mean, that starts as early as daycare. Um, so when we're preparing our children for elementary, middle school, high school, we're not saying things like you're going to have a great time, this is going to be fun. We tell them all of the things to be careful of. We tell them all of the ways not to be noticed in school. We tell them all of the ways to not be viewed or try not to be viewed as individuals who are problematic or sources of conflict. Because the simple fact of the matter is that our children are adultified. So they are looked at as, we know that children and people's brains don't finish fully developing until 25, 26. And so most of the time when it comes to non-Black children in educational systems, they go, oh, we know that these people's minds are not fully developed. And so they're going to have behavior that's not necessarily going to reflect good decision making. And when that comes, we're going to help guide them into better decision making. When it is Black children, typically that is not the approach or the mindset. The adultified approach or mindset is these individuals are going to be troublemakers. And so we need to be watching for signs of that. And when we see behavior that indicates they're going to be what we thought, we need to view that as an opportunity to punish them so that they understand not to repeat the behavior. We know that. We may not have that kind of language for it, but we know that. And so we teach them how to be seen and not heard. I mean, I know that there are a lot of communities where they speak that, but in our community, it's a big deal and it's a real thing. And we speak that to them in that when they start getting older and we know they're going to be getting jobs and entering the workforce, whether it's part-time jobs in school or whether it's as an adult, we start explaining, you have to be better than everybody else just to be able to keep your job. So understand that you cannot make waves. If you see something wrong, don't say anything, because they're going to attribute that wrong and link it to you somehow, and you'll be the one that ends up losing your job. Don't expect to be promoted. Don't expect for your ideas to be respected. Just be grateful to be able to keep and get a job. So that is the adaptation as we continue moving through and we're in, modern day society. That's what we're looking at. So yes, what you read is true. Yes, it is incredibly demoralizing to our young people growing up. What I try to do with my own daughters is somehow stay in the middle somewhere. I don't want them to be thinking, unicorns and rainbows. I want them to know that they matter. I want them to know that they should feel like they should be able to use their voices and advocate for themselves. But I also do alert them to the dangers of who they are. So, yes, it is a constant exercise in adaptation.
Thank you. That was
Thank
a
you for that.
powerful example.
Thank you, Anne. Thank you for bringing that up. I appreciate that. Is there anything else anybody's thinking about? Well, I think we want to bring her into our work. What does that look like? How do we still stay true to our mission and our branding and still bring in new language, new ways of looking at things, new ways of approaching things? Does anybody have those kind of questions? I'm happy to allay or assuage any concerns, fears that you might have about dipping your toe into that water.
Hi, I had a quick question. My name is Caroline. I'm with the Iowa Cancer Consortium, which is the state's comprehensive cancer coalition. And I feel like there's this old paradigm of like looking at cancer where we blame the individual for actions like smoking or maybe not having the best diet. And we're trying to move away from that language to look at like a systems approach. Like, why are these chronic health issues existing, which can lead to like a higher risk of cancer? So I'm just
Yeah.
curious, like what strategies you've used or what language you've used to like help people understand the links between unresolved trauma and chronic health issues.
Oh my gosh, thank you so much. First of all, Caroline, I'm so excited to hear um, how you're looking at more of the social determinants of the health outcomes versus, well, why didn't you do thus and so, right? Well, I was getting my certification, and this is language that I've been using without seeing this example, but there was this story that we had to dissect about the big P and the little p. Like, what are the policies federally, statewide, countywide, and then what are the policies in different organizations or in different systems and settings that are impacting this health outcome. So the subject's name in this pretend scenario was Jessica, and she was pregnant. And she was dealing with cancer, and she was also dealing with, there was one other health outcome that she was dealing with. But it was so beautiful how they went all the way back to the fact that Jessica's parents were dealing with depression and substance abuse, and that the large policies had cut out the funding to the areas where they lived and could get access to medications for depression, therapy for depression, and constant care for and support for substance abuse. So her father had been clean for a while, but then once that got cut out and he didn't have access to it anymore, he fell back into substance abuse. She ended up, because of where her parents ended up going, because her father ended up getting arrested and going to prison for something that happened at work while he was under the influence of a substance. She ended up having to leave home in her early teens. She ended up getting pregnant. Well, because of where she worked in a casino, and because they didn't have any pregnancy policy that allowed her to be able to stay away from certain parts of different harmful situations. Well, in casinos, you can smoke. In casinos, you can. So it was crazy how they helped us see the entire link. And so when I'm talking to organizations about things like that, we talk about, let's not just say we're going to be nicer to Black women when they come in, or, let's really think, what is it that you're not thinking about that's cutting off certain levels of access, that's making social determinants of health there's more negative indicators and contributors for these things. And it's been a really good process with the very few organizations who have done more than just, oh, well, we see she's got training, we're going to take her baseline training, and then we're going to say we had this training, and then we're going to move on. There have been a couple of organizations that have said, no, we want to dig deeper and we really want to get this. We really want to understand why we're not doing better with what we're trying to do. And it's been really great, even to just thinking through things that people don't consider, like, okay, if I'm only having these free clinics at certain times of the day, on certain days of the week, and this is a poverty-stricken area, they're going to be working during the weekdays, they're going to be working or doing things that they're trying to do for their homes in the evening. We're not doing anything on the weekends. We're not thinking of swing shift. So we've got great programming, and we even got a Hispanic or Latin community health worker, or a Black community health worker, or someone from the queer community that's a health worker. But the times are wrong. So they're never going to actually show up at these things because nobody can get to them. Those things really do matter. And so, Caroline, that excites me so much to hear what you guys are doing, especially regarding cancer. And again, Black women are having some of the most horrible outcomes with cancer, and not just with the instances of getting cancer and breast cancer specifically, but in having the more aggressive forms of cancers. So thank you so much for that. And if you and I could talk offline, I'd be so excited.
Yes, me too. I was like, I'll look through your Calendly right after this. Yes, thank you
you.
so much.
Yes, ma'am. Thank you. What else? How can I help? We got about 14 minutes, or I guess I should say more like 10, because we're gonna probably end at 5 minutes to the hour.
I have another question if no one's gonna go. Sorry. I can
Do it.
jump in. Yeah. Well, I'm just curious. I know just lived experience, and I mean, this is heavy work. And I'm sure, like, I'm just curious, like, how do you take care of yourself, and what brings you joy in this work?
Oh my gosh, thank you. And I feel like that was super intentional of you, just giving me a reason to talk about joy for me in this moment. So thank you, Caroline. God, ooh, I appreciate you. So number one, this work is part of my sanity, right? When we're talking about 15 years of my adult life, and then we're talking about my entire childhood, I've spent most of my life being oppressed and victimized without realizing it, and just fighting the air. So when I'm working and I know that my work is helping change outcomes, that's a level of restoration for me. So that's number one. Number two, I am very intentional about my space. So when I say that I'm done for a day, and it might be at 2 o'clock, it might be at 11 o'clock in the morning, or I might work really long another different day. But whenever I say I'm done for the day, I'm really, really done. Like, I don't peek at stuff. I don't do any of that, because I know that that's important. I'm also very, very focused in what I do, as far as a friend of mine who's a therapist said that self-care is not spas and mani-pedis. It is the intentional and daily process and practice of processing out trauma and stress so that it does not stack up on you, So every single day, I find space for reminding myself of whatever those days' wins were, reminding myself of whatever I'm grateful for in that moment that I can call out to myself. I make sure I find ways to relax and decompress. I make sure that I meditate. I make sure that I listen to music that is very non-stimulating at different times in the day. I spend time in nature and just look at the clouds or just let the wind blow on my face at different times. Getting your feet in the earth at times and just standing on flat earth without my shoes on and digging my toes into the earth is literally a very physically and spiritually grounding experience. I try to be intentional about doing that. And I surround myself with people who get me because I am definitely a unique bird and I know that. And so making sure that I'm around people who I can um, not be the expert around and I can just let that go and they get me and they're there for me. I'm very intentional about building those spaces for myself weekly or throughout the week. And I guess my biggest joy right now is anytime somebody says, either your work is helping me do something different that I didn't expect to do, but I see why and I'm doing it and I feel good about it, or a survivor or co-survivor says, I feel seen in this moment by you. Caroline, you are so good for the soul. Got a few
What a
minutes
great
left.
question.
I know, right? We got a few minutes left. I can probably turn it back over to you, Jenna, for anything else you need to do.
Yeah, I don't have much. First of all, I just want to thank you, Courageous, for joining us today. This was very enlightening and very educational. So thank you for sharing your expertise with us, and for the rest of you, the 40 some that joined to spend the lunchtime with us. I did put a link in the chat, so feel free to take that quick survey before you jump off today. And the IPHA Education Committee is in the process right now of finalizing our 24-25 series. So keep an eye out for that. The schedule will be coming later this summer. And just a reminder that this will be linked to the YouTube channel. So look for that and go share it with anyone who was not able to attend today but needs to hear this important information. So, and yeah, the comments are just coming in right now of just your gratitude for your perspective, the perspective, Courageous, because it's been very valuable information as Don has said, and Heidi. So
I'm
thank you
so
all
glad to
again.
hear that. Mm-hmm.
Yeah, we do still have a few more minutes, so if anyone has one last question, we can take one more before jumping off and letting everyone have their time back. Okay. Well, thank you again, everyone, and thank you, Courageous.
My pleasure.
Thank you, Courageous.
Thank you. Have a great day, everybody.